Right.
Well, I guess if I'm going to start with the organizations that I am part of, I would start with this one here. You came to see me at Rady Children's Hospital, and that is where I work and see my patients, and so that's a big part of where a lot of the research gets done and where all of our patient care gets done. And then you mentioned a foundation that I'm the president of, and that's Setting Scoliosis Straight Foundation.
Yes.
That's an organization that is focused on research, funding research, and also on patient education and increasing awareness around scoliosis and trying to establish treatment pathways and best practice guidelines and works with both surgeon groups and patients.
Perfect.
And then the last organization that I'm involved with and currently the president of at the moment is the Scoliosis Research Society. And that's an international organization that represents all of the healthcare providers, primarily surgeons, but healthcare providers in the field of scoliosis and spinal deformity. So that group has a footprint all over the world.
Yes.
With
Yeah.
folks that are trying to understand research, or trying to understand scoliosis by doing research and education and advocacy as well. It's a little bit hard to narrow it down, but let's just start with some of the basics. Scoliosis is a curvature of the spine when looked at from the front or the back. Typically the spine is straight in that direction.
Yes.
And there's a little bit of a curve from the side profile. Thoracic spine has a round back deformity called kyphosis, and the lumbar spine has a sway back deformity called lordosis. And many people have a small curvature, but we don't consider that scoliosis until the curve gets big enough. And the way that we measure scoliosis is with an angle called the Cobb angle. And if the Cobb angle is 11 degrees or more, we call it officially scoliosis. And if it's a small one, we just call it spinal asymmetry. That's very common in the population and not in any way pathologic or problematic or any issue for people. So it's really these bigger curves that we worry about. Lots of people can develop scoliosis, but the type that is the most challenging to identify is the type that happens in otherwise healthy teenagers as they go through their growth spurt. And this form of scoliosis is typically called adolescent idiopathic scoliosis. It occurs in adolescence. It's idiopathic, meaning we don't know the exact cause of that condition, and scoliosis is the name of what we're talking about. It also tends to occur in many other associated conditions and syndromes. So if you have some underlying problem with your muscle, either it's weak or spastic or paralyzed, scoliosis can develop. If there's a problem with the soft tissues, in many associated syndromes, the ligaments aren't quite strong enough and the tissue's not right, and scoliosis can develop. And similarly, if you have some underlying neurologic problem, either in the brain or the spinal cord,
Interesting.
You can develop a curvature of the spine. So you have to have really good control from your brain, and you have to have really good tissues that you're made up of for this flexible spine to stand up straight and not collapse over time.
Yeah.
And if you don't have all that, sometimes you get scoliosis. Treatment, I guess I would put in three big buckets.
Okay.
The first is many times we don't have to do anything except observe. Just kind of keep track of it and make sure that this small curve is not progressing. And so observation turns out to be the most common method of treatment, actually, which is, you might say that's not treatment, but watchful waiting or observation is a really important method. We use that for all curves that are small, and we use it for most people who are done growing.
Yeah.
So when you're done growing, the curves don't progress as fast, and when you're young, they can progress a lot. So if you're growing, we watch close. If you're done growing, we watch not so frequently. The next big category is some form of an external brace or a plastic orthosis that we use to push the body around to try to push the curve straight.
Mm-hmm.
And the idea for that is to mold the trunk with the spine a little bit straighter and wear that brace during the period of remaining growth. So that could be a couple of years or even more for some kids.
Yeah.
It's not the most fun thing to spend your life in or do, but if it avoids the third method of treatment, which is surgery, then it's probably really worth it. So we really encourage people to wear their brace if they're in that range where it'll prevent them from having surgery if it's successful.
Mm-hmm.
And then surgery, unfortunately, is used, I guess I shouldn't say unfortunately, but we don't want to have people have surgery to fix a curve, but if your curve is bad enough to need that treatment, it's a very effective method at preventing the curve from getting worse and then making some correction of the curve so that it doesn't continue to give you trouble later in life.
Okay.
When we do that surgery, though, we typically fuse the vertebra of the segment of the spine that was involved in the curve,
Mm-hmm.
and then that segment of the spine no longer has its flexibility. So we sacrifice some flexibility in the trunk
Mm-hmm.
and in the spine in order to prevent the curve from progressing and causing troubles later in life. The typical indication for surgery for scoliosis is those curves which would continue to progress once growth is finished.
Gotcha.
And it turns out that for the thoracic region, this
Mm-hmm.
upper chest region,
Yeah.
it's about 50 degrees.
Gotcha.
And for the lower region, it might be as low as 40 degrees.
Mm-hmm.
So somewhere in that range is when we flip from saying it's okay just to watch it to we believe this curve will continue to progress in your adult life.
Yeah.
The good news, if it does, it's going to happen relatively slowly, so it's rare that surgery is urgent
Mm-hmm.
if you've finished growing. If you're in the midst of your growth spurt and your curve is blown past 50 degrees, then it becomes, it's not quite as elective. You kind of need to get to it,
Mm-hmm.
maybe in 3 to 6 months, as opposed to, well, we could do it this year, next year, the year after, doesn't matter. So
Mm-hmm.
once you're done growing, the urgency kind of drops off. And
Mm-hmm.
we have lots of people who want to do dance or gymnastics or play football for a period of time and they want to get through their sporting career before they have their surgery, then it's fine. Once you're done growing it, that works out just fine.
Mm-hmm.
The bigger challenges are those kids who have a big curve but are still growing and they have a chance for the curves to really get substantial in that period of time.